about the COVID mandate and the Supreme Court ruling. Now, there are two rulings, to my understanding, correct? It wasn't just on the federal worker mandate; it was also on the healthcare worker mandate. And so, I guess you'll explain both and everything. But Pat, go ahead, set us up. What's happening here?
Yeah, so this ruling just recently came forward, and it was the OSHA case. So an important thing to understand about this ruling just off the bat is that this is a preliminary injunction that is going to block the enforcement of the mandate while other litigation continues. So this is not a final ruling on the issue. When you file in court, sometimes, I mean, we all know that it's a government court system, so it's not very fast. And so a lot of times when you have an issue where there's grave irreparable harm that will happen if this policy is allowed to go into place, there will be what's called a preliminary injunction. And so there's been a fast appeal to the Supreme Court to determine this preliminary issue. And so litigants in this case are looking to block the enforcement of the OSHA mandate and of the Medicare Medicaid healthcare provider mandate.
Just to clarify real quick, Pat, was that the only issue in front of the court? Could the court have actually ruled on the whole OSHA mandate itself? Which, by the way, to clarify, it's you have to have the vaccine or wear a mask and test weekly is the actual mandate that they have here. So could the court have ruled against the whole thing, or was the only issue in front of it to rule on the injunction or not?
So as far as I understand, the only issue in front of the court was to rule on this preliminary injunction. Okay. However, it does give us a view into what might happen in the lower courts, because part of the test is to see whether the claim is likely to achieve on the merits, to prevail on the merits. So this is the Supreme Court saying that the OSHA case is likely to prevail on the merits. That meaning that the mandate is likely to be defeated. And that's kind of what the standard is. The other part of the standard is... Go ahead, sorry.
Oh, sorry. Just to understand. So I guess it may be the ideal world, Pat, right? Like, actually what matters is what, arguments get brought in front of the court and everything like that by the attorneys. And so maybe this shouldn't be that big of a signal for what the Supreme Court will rule on. But is it pretty solid that the Supreme Court grants an injunction? They're very likely to rule that same way if the case comes in front of them.
Yeah, I think that's fair to say. At this point in time, I don't think it's clear that the case will be appealed back to the Supreme Court, because effectively what the Supreme Court did is that they took this case, which was a fast-tracked appeal from the Sixth Circuit on this preliminary injunction issue. They took it and they ruled on it and they sent it back to the Sixth Circuit to continue.
Okay. All right. Well, and then do you know if the other ruling, the one on the healthcare workers mandate, was also just on an injunction, or if that was actually on the mandate itself?
My understanding is that it was an injunction.
Okay. All right, great. All right. So get back to, where you were before I interrupted you a couple questions ago.
Oh, no worries. Yeah. So just to differentiate so everyone understands, I think there's been a lot of coverage, but just to make sure, yes, the OSHA case would apply to any private employer employing 100 or more employees, and it would mandate vaccination, or I think that it allows for religious or medical exemptions, but it also will force these employees to, the testing requirements or the exemption.
Right.
And different mask requirements and things like that. Then on the other hand, there is a vaccination requirement for any healthcare facility that accepts Medicare and Medicaid patients. In that case, it's called Biden v. Missouri, and the OSHA case is called National Federation of Independent Business v. Department of Labor. And just to dive into kind of some of the reasoning behind the ruling here, in the OSHA case, the court really kind of took a look at what the authority that OSHA has to do these things, because if an administrative agency is going to be given authority to do things, they have to be given authority through the legislative branch, which in theory represents the people. And so I say that in theory. But what ultimately the court's decision kind of turned on, and Gorsuch wrote a concurring opinion. So it wasn't carried. Gorsuch's concurring opinion wasn't carried by the majority of the court, but he wrote just to kind of clarify that OSHA has no authority to dictate matters of public health. And so the Supreme Court really made a distinction based off of what the purpose of OSHA is and what their authority is. OSHA is supposed to protect health, or excuse me, they're supposed to protect working conditions. And they really said that a vaccine mandate is a public health issue, and it's not a employer-employee issue, because COVID-19 exists everywhere. It's not unique to the workplace. And a vaccine is like a very invasive procedure, they wrote there. And it also, it provides, in theory, provides protection, not just in the workplace, but also out and about.
Okay. And just to, I guess, out of curiosity, is there an argument here, I guess, on executive power that is being made at all? So, because it seems to me like I remember the old test that I used to talk about when I was in high school and debate and everything was, the executive has the most ability to carry out executive authorities and stuff when it's in line with what Congress wants to do. And it's pretty clear that this isn't in line with what Congress wants to do. So are they trying to make the challenge on hey, you can't just mandate this? Congress would have to pass a law if this is going to be the regulation that everybody has to abide by.
Yeah, and that's a great issue to key in on. It was Gorsuch specifically mentioned in his concurring opinion. He was joined by Clarence Thomas and Justice Alito, saying that it's clear that Congress rejected this because there was a vote in the Senate rejecting this. And OSHA, my understanding is that whether or not the president directs OSHA to do something, it's more a matter of whether or not OSHA has the ability to do that. And I believe that, is it your understanding, Kyle, that administrative agencies are part of the executive branch?
I would assume that OSHA would be under the authority of the executive branch, right? I don't know under what agency, but I would assume that would be a subsection of an agency, but I'm not sure.
Yeah. Well, another thing that came in was this talk of how destructive that it would be to private companies. And that's part of the requirements for an injunction, is that to prove irreparable harm, if the OSHA mandate goes into place, the steep fines and the potential loss of employees is a harm that could not be remedied. It's something that's irreparable. And so what happens if you allow this mandate to go into place, and then later on it ends up that it doesn't hold weight on the merits in the final judgment, and you have all these people who have left their positions, all these companies that are destroyed, even though it was done over nothing. And so that's kind of the point of this whole injunction.
And I just checked real quick. OSHA is a part of the Department of Labor, so that's a cabinet level position. So I would assume that's all acting at the direction of the president. It should be assumed. So I guess here too that this would be a question of, Pat, if there was a law on the books that would require specifically any new regulation that impacts $1 billion of business or something like that, to have to go through Congress rather than just being able to be levied by executive fiat, would be something that would stand in the way of this. Unfortunate that doesn't exist, but that would be a way to rein in these federal agencies a little bit, I suppose.
Yeah, and I think it'd be a different issue if Congress were to pass something like this. The standard would be different, And instead of trying to determine whether or not OSHA has the authority to do this, they would be doing more of a challenge based off of like a constitutional claim, with the varying levels of review that you talk about in constitutional law and law school, whether that's rational basis review, rational basis with a bite, intermediate scrutiny, or strict scrutiny. And I would think it'd be strict scrutiny, which would require a narrowly tailored policy to really prevent disease. And it'd be interesting to get exactly what the evidence is on that, because famously the court, I think it was Justice Sotomayor, who's really known for being kind of a liberal nut job. She had this completely, she said that there's 100,000 children who are currently on ventilators in the United States with COVID, and that's just patently false. So
right.
It's terrifying.
And just to clarify, I believe she said who are like seriously ill with COVID or something like that. Because people get so picky over it. Not that that's really different from what you said, but I think she said seriously ill. And I think according even to like the CDC, the number is like 3,000 or so. And even then, I'm sure there's some questions around that number. But can you imagine, Pat, if say Rand Paul was citing some numbers on the number of people who died after receiving the vaccine or something like that, and inflated the number by like 3,000% or something like Sotomayor did? I'm pretty sure he would be banned from every platform, and everybody would be running ads about how he's killing Americans and everything like that. And there's absolutely no real, I mean, like the right is going after her, and honestly, a lot of it gets to be a little hacky, and they're just looking for the easy dunk and all that, but it does deserve real criticism, and it's a really, really wrong statement. So on that, in the actual like rulings and everything that you read, is there anything about the effectiveness of the vaccine that either came out in this case or that was relevant to deciding the case?
Yeah, I think in what I read of the majority opinion in the OSHA case, it seems like it's just kind of taken for granted, in my opinion. It seemed like it was taken for granted that the vaccine prevents admission, and it like prevents hospitalizations. And I mean, frankly, I don't know if the evidence was borne out in briefing, or, the evidence to support that assertion was borne out in briefing or oral arguments. But I think it was even Gorsuch, if I'm not mistaken, in his concurring opinion that said that, yeah, well, the vaccine helps reduce admission. But it's really funny because, the definition of vaccine has changed in the last couple of years. And so you would think that, a vaccine would provide immunity. But that's just my editorialization.
Right. And I guess, too, I wonder if, this is something that really gets, I think, conflated, where people will say, oh, the vaccine prevents transmission or prevents hospitalization, where I think even the official claim is that it reduces your chances of being hospitalized and everything. And I mean, if you look at the official data that's put out, they certainly, paint a case that you can reduce your chances of hospitalization if you get COVID, if you take the vaccine. But that is based on the data that we're getting, and it's certainly not a prevention thing, which is, I think, important, where this really gets conflated. And then people who are just watching CNN, they hear, oh, if you get vaccinated, then it's going to prevent you from being hospitalized. That could cause people to take undue risk that they wouldn't otherwise take if they were given the correct information. And so I don't know, that's just a problem I've noticed in like the media, and particularly the mainstream narrative lately, not just trying to rip up on vaccines, but to actually talk about like the effect that that rhetoric has on people. Pat, anything on the other case, the federal money vaccine mandate? The healthcare workers.
One final note, though, to your point, the Biden administration in the OSHA case argued that the mandate would, quote, save over 6,500 lives and prevent hundreds of thousands of hospitalizations. Okay, well, I mean, if you're talking about kind of an unprecedented mandate on employees to take an invasive medical procedure, and your argument is that it's going to save 6,500 lives. I mean, it's just absurd to me. The like it in
Wait,
order
6500, like
yeah,
six, oh wow. So
6,500.
so and I mean, like, if we're talking about those numbers, and how many people are they actually thinking that it's going to move the margin on getting vaccinated anyways?
It's
Not very big.
The government expected the mandate would cover 84 million workers.
Well, how many people are going to get vaccinated because of that? That's more my question.
Right. Yeah, I don't know.
Or because if like 80% of them are already vaccinated, and then only 10% of the remaining get vaccinated, and the other 10% all quit, then that's not, I don't know, very effective, I would guess. But I don't know by what standard we're on here. But the healthcare worker mandate.
Yeah, so Biden v. Missouri, the justices agreed to allow the Biden administration to enforce nationwide a rule that requires nearly all healthcare workers at facilities that participate in the Medicare and Medicaid programs to be fully vaccinated against COVID-19 unless they qualify for a medical or religious exemption. So the Department of Health and Human Services issued the rule, which applies to more than 10 million workers. So that rule was issued in November, but there were two federal district courts in Missouri and Louisiana that put the rule on hold in roughly half the states. So they're talking about a preliminary injunction that occurred at a lower court level.
And I think I covered this one on the show. There were two different cases. One was through the Louisiana court, I believe.
Yep.
14 states there were exempt from it. And then there's the 10 that were through the Missouri. I think it was a St. Louis court that rejected it. And so there's kind of like two cases, and I guess they're a little bit different, which is where like my legal knowledge makes it hard for me to continue covering this, because it's not as simple as, just one size fits all for the whole country. You got cases here and there and everywhere else.
Yeah, and that's, I mean, frankly, the procedure for this can get really complicated, especially if you're not someone who is used to, I mean, even as an attorney like myself, if you're not someone who's used to keeping your eye on federal litigation, it gets a bit confusing, and it takes some study. But the court, its reasoning, it emphasized that the Department of Health and Human Services has has required vaccination in the past. So they said HHS has long required Medicare and Medicaid providers to comply with a variety of conditions if they want to receive Medicare and Medicaid funding. And they said again, the court reasoned that because COVID-19 is, quote, a highly contagious, dangerous, and especially for Medicare and Medicaid patients, deadly disease. So you're getting kind of that mainstream kind of narrative on what COVID is, which at least in a sense, it reflects reality, because it is those populations, the older population, who's actually at risk for this.
Yeah. And so this would apply to like not just a hospital, which is I think what people are thinking of here, but also like rehab facilities and long-term care nursing home type facilities, which that's where like I don't know, maybe I'm a little bit more concerned, like not that working in a nursing home is like a bad career or anything like that, but it's maybe not the greatest job to deal with people who have like dementia and Alzheimer's, and who could be aggressive or belligerent, and who don't have control of all their functions all the time. And it's just it could be a tough job, and so you're maybe giving them an incentive to just leave the career. It seems like at certain levels, psychiatric hospitals as well, these are places like Rhode Island is deploying the National Guard to the psychiatric hospital, which seems just a little bit concerning to me. But they're having to deploy National Guard to these long-term care facilities, and you just have to wonder if you're taking young men who thought maybe they would be fighting a war, maybe they would be filling sandbags or something like that. They probably never thought they would be changing adult diapers. And so when you put people in that condition, it does lead to cases of like, neglect or even abuse. I imagine there's a real risk of that increasing, having these people doing it and not people who are necessarily, being paid to be that kind of, worker.
Yeah, I think it's really long-sighted of you to even think of those issues that might come up. I don't know if the court has, and I don't know.
Just that you mentioned that real quick, I want to say this because this is something that I had talked about like last May when I was really concerned about the lockdowns. And that is just, understanding like the third and fourth order, like effects of poverty around the world. There's this new study. I'm trying to find the article here real quick. It's from Yahoo, and the study goes into and explains that there's a huge spike in underage pregnancy or childhood pregnancy in Zimbabwe as a result of this. The schools were closed down, so you have 13-year-old girls who go and get themselves impregnated by older men, hoping that that's essentially their ticket in life to have some sort of life, because you'll have a life with somebody who's wealthy. Essentially, the family like tries to leverage, like, hey, you had sex with my underage daughter, so either marry her or we're going to press charges and everything like that. And so, putting just a miserable situation in place, right? And you of course, there's plenty of room to say, well, it really doesn't make sense to get pregnant. This is a 13-year-old girl who no longer has access to school because of the COVID lockdowns. There's no online learning in Zimbabwe for a lot of these kids, right? And so when the schools close, the education closes, and so they see that pathway in life close, and the only other option to avoid probably having essentially no options and no quality of life in Zimbabwe for these young girls, or at least again, imagine from the perspective of 13-year-old you, not 30 or whatever year old you is listening to this right now. It doesn't surprise me at all they're making these kind of decisions. And so something that nobody is, really cares about when they're advocating for lockdowns and things like that. But there are long-term effects of this poverty, and the global poverty rate is going up for the first time in 20 years. And so it's not something that's going to go away tomorrow. You can't just, even if you lift the lockdowns, the additional people in poverty are going to take years to claw out of it, as probably it's going to take years or so for the supply chain to come back to the, same quality it was, and the same, even again, if the lockdowns are lifted tomorrow. I'm saying this. So just want to mention that. Pat, anything else on these cases? If not, I got two more like kind of libertarian-esque questions on them.
Yeah, well, just to touch on your last point, if you really want to get down to base principles, that this is the essential lesson of Henry Hazlitt's Economics in One Lesson. This is the praxeological analysis that the Misesian has. Basically, when you're talking about a given economic proposal, to basically take into mind all of the effects of a given policy, the seen and the unseen. That's Bastiat. But I think this is a good example for Misesians and Rothbardian libertarians to come in and really try to provide that analysis that isn't really happening. But yeah. What's your other libertarian question?
Yeah, just that it should have been obvious for anybody who's a libertarian from very early on when they start these lockdowns that they were essentially trading elderly lives in the United States for the lives of young children living in severely impoverished countries like Africa, Southeast Asia, and the Middle East and stuff like that. So anyways, the libertarian, I guess, based questions are, and I guess answer this in two ways. Are people making the arguments, and do you think the arguments could be made? And I guess the first one would be kind of on maybe a First Amendment or HIPAA ground somewhere in there, like the right to individual like choice, or obviously that's not in the Bill of Rights, but I don't know, maybe they could somehow tie this into like a First Amendment, of course, freedom of religion type argument, but maybe something else in there where there's people who aren't religious, but that I guess doesn't necessarily mean like you can't like claim that like I'm spiritually Kyle, and anything that enters my body that's not of my choice is a violation of my spirituality. And like, are we really going to say that's more illegitimate than Christianity in 2022? Like, that seems like kind of an argument that you're not allowed to make anymore. So like, I'm wondering on that level, can you make an argument? And then also 10th Amendment, should this maybe be an issue reserved to the states?
Yeah, and I guess the most meaningful commentary I can provide on that within my wheelhouse is just talking about the nature of the Supreme Court in general. And I think you have have we talked about John Hasness's The Myth of the Rule of Law? I mean,
I think so.
Yeah, it's just basically that there is no right answer when it comes to the law. There's no objective truth. He gives the example in this essay, John Hasness does, of when you're in law school and the law professor asks you, he gives you a given fact pattern, and he asks you what's the right answer given the Supreme Court's jurisprudence. And two different law students can give totally different answers for the opposing sides even. These answers conflict, and they're both right because there is no right answer. And so I guess really that just leading in to say that, in my opinion, the Supreme Court is just playing makesy-upsies, for lack of a better term. There's no objective answer of whether a thing is constitutional or is not constitutional. It's politics. They're not above it. It's just, if you're smart enough, you can create an answer that justifies any intrusion and any violation of the Constitution. That being said, though, when you play the court's game, you have to play the court's game. So when you go in, your arguments have to be focused on the issue that's at hand. And the reason why we're not seeing it here in this case is because this is confined to a preliminary injunction. And I guess the arguments more so, the lawyers lead with the arguments that are most likely to win, in their opinion. And an argument saying that OSHA doesn't have the authority is the one that's most likely to win. So you're not going to lead with an argument based in the Bill of Rights if those arguments aren't as good as the OSHA arguments. That being said, other cases certainly are leading with the arguments based on on a Bill of Rights claim, like First Amendment, Fourth Amendment, Fifth Amendment kind of stuff. But even within that sphere, you are confined by the precedent set by the court that they just made up. And so you got to go within, that corner of it. So, we might read and say, hey, it says here in the Constitution, Article 1, Section 1, First Amendment, Congress shall make no law abridging the freedom of the press and of the people peaceably to assemble. That might make total perfect sense to us. But guess what? In the past, the Supreme Court has 70 or 80 cases that defined what that means. And so even though it says plain words on the sheet of paper, you can't just lead with, okay, this clearly is in violation of the First Amendment. I mean, people, if you're closing bars and churches, or if you're not allowing people the freedom of association to go to a bar or to do whatever without getting a vaccine, that clearly violates the First Amendment. Well, they have all this precedent that they can make up whatever they want.
Yep.